Thank you, Veronica, for the recording, and I would like to inform everyone that we will record our webinar and kindly ask for your consent. If there are no objections, we will record it, and it's already started. Thank you, Veronica. Okay. Many people are in the room now. Can you say to me? Okay, one more minute. Okay, I guess we can start now. And so I would like to welcome you in our webinar and just would like to note you once again that our webinar is recording now. So also we have to have our webinar in English, but also we have Arabic translation. Please make sure that you connected to the right channel at the bottom of the Zoom screen. Now we're starting our webinar, Creating Access to Mental Health and Psychosocial Support across Continuum Care, where we would like to discuss with you how the Red Cross and Red Crescent movement provide MHPSS services covering mental health and psychosocial needs. My name is Olga Rusakova, and I'm working for ICRC Regional Office for Europe and Central Asia as a Regional MHPSS Delegate. And I'm really excited to be moderator of these webinars and would like to thank Working Group 2 for this opportunity to see so many people from all over the movement and to talk about such important topic like coordination and cooperation within the movement and external partners as well. Also, I would like to introduce you my colleague Veronica from Psychosocial Support Center. She's now responsible to follow up your messages in the chat, and she already introduced herself. Please do not hesitate to reach her if you will have any challenges or threats during the webinar. Also, Veronica will be responsible to follow up to follow the questions for our speakers during our webinar. I'm kindly ask you to introduce yourself in the web chat. Also, please text your name, your national society. I kindly ask you to do not use acronyms, just to let us know where you're from. As well, if you would like to receive any kind of documents that we will able to share with you, please write your email address as well. I also kindly ask you to keep your microphone muted during this session, just to provide our presenters a floor to present their presentation. Your questions and comments could be texted in the chat, and after each session we will have a session on questions and answers where we will be able to discuss the points which will be present by our presenters. Also, some questions, perhaps it's possible, will be responding in the chat box as well. Also, I would like to encourage you to use reaction button, which is in the bottom of our Zoom meeting, just to stay closer to use this wonderful opportunity of Zoom to share our emotions and to support our presenters as well. Like now, I would like to send you a heart with warm welcome to our webinar. Please feel free also to share your emotions as well. If all practicalities are done, I would like to start officially our webinar, and I would like to start with to express my big emotions around the MHPSS development during recent years within the movement. I guess you will agree with me that we are now stronger and can provide more efforts to the people in need all over the world. A lot of professionals from the global level in the movement, as well in the national society, HQ headquarter units, departments, divisions in each national society is different. Experts, advisors, and professionals work hard to improve our efforts to strengthen quality of our services. As well, people from the local branches, and I guess you know very well how strong are they and how many efforts have been done during the past years. And it's really exciting to look how strong at the moment we are right now. I guess that the coordination and cooperation within the movement, as well as with external stakeholders, is quite important for each of us to strengthening our efforts and ensure accessibility to the services. And now we are pleased to invite you to talk about that, to discuss, and to have seen what is going on. During the next, I guess, almost 80 minutes, we will discuss a global approach of the movement to strengthening MHPSS activities. Also, we will talk in particular about coordination and cooperation. And then we will follow with a session from the field, which Iraqi Red Crescent will present their efforts, as well Ukrainian Red Cross, and many thanks for them to agree to share with us their great experience in MHPSS from the ground. So I would like to pass the floor to my colleagues, Natalie Regal from the ICRC PS Center. She is a project coordinator for the movement-wide MHPSS Road project. Hi, Natalie. Nice to see you. As well, Louise Kryger, she's psychologist and the MHPSS lead in international department of the Danish Red Cross. As well, I don't know if Sarah already joined us, but I guess she will, yeah, as soon as possible. Sarah, she's a clinical and forensic psychologist and the program coordinator in charge of MHPSS at ICRC headquarters in Geneva, and I hope that she will join soon. Louisa and Sarah, also beside their roles in the National Society, also leads the Red Crescent movement working group on collaboration and coordination. So the floor is yours. Please go ahead. Natalie.
Thank you. Okay, good morning and good afternoon to all. I see that, especially from the chat, we are representing a lot of places of the world today. All right, so I am Natalie Helena Regal. Thank you so much, Olga, for the presentation. Before we give the word to the presenters, I would like just to give a little bit of context of the Working Group 2 of the MHPSS Roadmap project and the MHPSS Policy. And Veronica will kindly support with showing a little video. Thank you so much for that.
In the following presentation, we would like to give you a very brief and simplistic introduction to the mental health and psychosocial policy, resolution and roadmap working groups. As for you to understand the connection with today's webinar and the MHPSS roadmap within the Red Cross Red Crescent movement. Every day, the Red Cross Red Crescent movement around the world is confronted with the extensive unmet mental health and psychosocial needs. The movement saw an urgent need to increase efforts to address the extensive unmet mental health and psychosocial support needs, and therefore, in December 2019, the movement made historical commitments and adopted a joint movement policy on mental health and psychosocial needs in all contexts. Also, together with 196 states, the state parties to the Geneva Conventions, the ICRC movement recognized the urgent need to scale up the collective response to the MHPSS needs of people affected by armed conflicts, natural disasters, and other emergencies. Turning our attention back to the MHPSS policy, its aim was also to contribute to an enhanced ICRC movement response by providing overall guidance to national societies, the IFRC and the ICRC on how to build a more harmonized, integrated, contextually appropriate and holistic response to MHPSS. With the policy, a roadmap document followed, highlighting 6 priority action areas on addressing mental health and psychosocial support needs. The roadmap sets out a strategic and coordinated approach in terms of the activities to be carried out individually by national societies, the IFRC and the ICRC, and activities to be carried out together. The ICRC, the IFRC and a group of national societies have supported and coordinated the rollout of the roadmap since 2020 by, for example, creating 5 working groups. These groups were officially formed based on the priority action area thematics. Working Group 1: achieve a basic level of MHPSS across sectors. Working Group 2: reinforce the movement's MHPSS collaboration. Working Group 3: promote the MHPSS well-being of staff and volunteers. Working Group 4: demonstrate the impact of MHPSS interventions. Working Group 5: strengthening the advocacy for mental health and resource mobilization. The working groups are a unique space for various ICRC movement actors to exchange experiences and work jointly toward the implementation of the MHPSS commitments. For more information on the MHPSS policy, resolution and roadmap, visit the IFRC Peer Center website, peercenter.org. Thank you for listening and enjoy the remaining of the webinar.
Thank you, Natalie. Louisa.
Yes,
Go
thank you. Thank you for setting the scene, Natalie. We will now be diving into a bit more around why coordination and collaboration and strengthening that was identified as one of the key priorities for the movement when it came to rolling out the movement policy and the resolution as part of the roadmap. So priority action area 2, which also forms the foundation for working group 2, looked at how we can develop a holistic MHPSS approach between the different movement components and in collaboration with others. So to strengthen the continuum of care approach and demonstrating what that looks like within the movement framework. First of all, this is not possible to do without coordination and collaboration. So we wanted to see how we can encourage national societies, IFRC and the ICRC to continue comprehensive and complementary interventions across all layers in this framework, in the pyramid that you are seeing on the screen now, emphasizing the complementary roles and realizing that when doing so, we need to also look at strengthening communication, collaboration, coordination. but not only within the movement, also externally, and promoting the external partnerships is important, as the movement cannot cover and should not cover all services and all needs. We can do a lot, but not everything by ourselves. So working group 2 selected 6 priority contexts to look at, to see how are we working within those national societies, with partner national societies, with the IFRC and the ICRC, to cover different layers in the framework. We looked at Yemen, Syria, Iraq, Ukraine. Then we had, now I'm having a bit of translation as well. We looked at 2 contexts where COVID was, when COVID hit. One for Honduras, where they worked on a peer-to-peer approach with another national society. And one was in Colombia, where they during COVID also had to respond to emergencies. What is important to highlight for all of these contexts is the fact that the national societies had to go out of their everyday scale for work. Veronica, are we translating in this room?
Channel?
Yeah.
If you're in the English channel, I just told the translators we just have English in the English channel. So I hope that is fixed now.
Okay, thanks.
Thank you.
So
okay. Jafar. Jafar, just mute, just mute, just mute, then.
You are in the English version or English.
Can you just mute then? Yeah.
The Arabic translation is in another channel, as far as I've understood.
I'm in the Arabic channel.
Why am I in the Arabic channel? I hear both. Veronica, I think I need a bit of a technical support.
Yes, if you go to the original channel, like under interpretation, and it says original channel, or then there should be no translation whatsoever. So maybe that is a solution for now, and I look into
I will try
translation.
Okay, thanks. Just to say that all joint collaborations between the national societies, IFRC and ICRC, have a responsibility to look at the needs, refer and advocate in relation to the full spectrum of the movement MHPSS framework. And look at what are the mandates of each of the components, but also look at what the political situation allows for. So this is also just to bear in mind when we talk about these different contexts, that it's not something outside the ordinary, it's not something standalone, it's actually what we're already doing within the given space. What has been interesting over the past years is this change from this onset of the working group's work till where we are today, and we will get back into that. We also looked at how we can integrate MHPSS better across different sectors, and that will allow the movement components and actors to reach more people and foster, hopefully, the provision of more appropriate services to the population in needs. This is both, of course, through information sensitization sessions, community trainings, direct support, or cross referrals, also outside of the movement components. Yeah. So we looked at identifying and showcasing, as mentioned already, the 6 priority contexts: Yemen, Syria, Iraq, Ukraine, and 2 COVID-related contexts, where we saw that there was an interest to improve collaboration and coordination, to enable the different movement components to provide more services across the different layers. then we had a mapping of the complementary movement activities across all the different layers documented, and you can find all the presentations for each of the different contexts. You can also find a lessons learned report, and at the end of this webinar also the webinar, as well as a podcast if you follow the link that Veronica will share in the chat. We also wanted to see if joining forces would allow for more structured and harmonized approaches. And in order to do so, we used the learnings from the working group to develop a project document and a MOU template, Memorandum of Understanding, that can be used by national societies when they're entering into partnership either with other national societies, IFRC or ICRC, to simply stipulate what is expected of each of the components and how this contributes to more comprehensive services across the continuum of care. With that also was developed a checklist for MHPSS collaboration, which is to be meant as an easy tool to sort of cross-check, have we done all the necessary steps? Again, the link for these tools are uploaded in or included in the chat. Finally, we hope that the working group would inspire how to integrate across sectors. And we found that one of the biggest learnings is the attention and awareness around the need for collaboration and coordination at management level, higher level within the institution. So as technical advisors, as technical leads, we can do so much, but we need to also have the buy-in for coordination and collaboration from management, whether it's in a country operation or it's at a headquarter level. So this is just to show you what the template and the project document look like, and the checklist. We of course also throughout the working challenges. Looking at, for example, we did this through discussions in groups during the webinars. We also analyzed the different contexts and their feedback from the respective presentations over the time that the working group has existed. And what we found was that there's competing financial and priorities of partners. So even though we're working towards the same goal, we might have different organizational priorities with different sector involvement, prioritization of different target groups or activities. And again, this call for higher level agreement at country level, at technical level, to strengthen the coordination and collaboration and to actually do more. We also identified the need for understanding what a continuum of care approach means with reference to the movement framework. That the understanding of this differs between the movement components. So there is still some sensitization to be done, because having a uniformed approach, having a uniformed understanding will also allow us for better coordination and communication, and then eventually resulting in access to services across the layers, looking at who is best placed to deliver on what layers of the pyramid or of the framework. Yeah. There is, as I think is not a surprise to anyone, but still stigma and discrimination linked to mental health conditions within the community and the authorities. And this also, of course, impact the movement's ability to provide services throughout the different layers. And we find that these global and longer standing challenges are not resolved in a coordination function like what we have here with Working Group 2, but it can also be challenging to solve at a country level, at a technical working group level. However, we see that it's some work that we still have to address, and we still have to flag both at global level and at country level. Then the change in volunteers and turnover of delegates and staff has also had a massive impact on the project's sustainability in the context where we work. So whenever there's a turnover of staff and volunteers, the relationships needs to be rebuilt, the institutional knowledge get lost, and this calls for better documentation and better handover processes. And also technical coordination and collaboration at country level, which has to be done over and over, and the trust building happens again and again, and this we have to just face that this can be a tiresome process, particularly in context where the national societies that are implementing activities have a number of partners who have a number of people turning over. So it's something to be very mindful of as a partner coming into a context. Yeah. What we then, and this goes maybe to answer some of these challenges, we of course also looked at what is working and what are enabling factors to enhance collaboration and coordination. In the context where we have already established partnerships and prior collaboration, when then, for example, COVID hit, or there's an emergency, or a situation changes like it has changed in, for example, Ukraine, already established partnerships and prior collaboration ease the coordination when situations change. So the better we are at establishing partnerships prior to emergencies escalating or context, or the situation change, the better implementation will actually flow. We also came to know that the more we know about the movement and recognize each of the different movement components' mandate according to the civil agreement, the better we are at utilizing each of the movement's components' expertise and capacities. And this will increase access across the framework. So we call for all MHPSS actors to actually know the civil agreement and also look into what is the mandate of the national society that's the implementing, those national societies supporting, and the ICRC mandate as well as the ICRC mandate, and see how all of these different components, when pulling their resources and capacities together, can do more and better. Then we identified the need to map stakeholders. So not only looking at what are the Red Cross movement doing, but also go beyond the Red Cross. And this is essential to identify the gaps in provision of services. So how can the movement components feed into the gaps, fill some of the gaps, but also link up with external stakeholders or external actors, be it the government or governmental institution or structures, providing a bit of advocacy and awareness raising with these institutions, but also with other MHPSS actors from other both UN agencies and other organizations outside of the movement. Yeah.
Louise?
Yes, go ahead.
Excuse me, Darren, you have 5 minutes.
Perfect. So to underline or to highlight the importance of this, we also want to emphasize the need to participate in the existing MHPSS coordination structures and not creating our own parallel systems, but as much as possible, really utilizing the existing structures that are out there. Of course, continue to participate in movement coordination and information meetings, also happening at country level, some also happening at global level, because this inspires and provides a bit of room for sharing what is difficult when implementing as a movement partner, but at the same time really having this outlook and utilize the existing structures to build respect and trust in the movement components, both amongst the partners, but also with other organizations and donors. And we do see that coordination efforts contribute to establishment of relationships between stakeholders and serve as a platform for new initiatives to take shape. Yeah. We also see that collaboration and coordination can strengthen the national society's capacity to strengthen their delivery of services, because it creates access to more services. This all depends on the human resources on ground dedicated to the coordination and the partnership, as that is key for driving forward the provision of a continuum of care. So really having trusting relationship is crucial in this matter. Then finally, we also see that partners, and where we had really successful coordination and strengthened collaboration, the partners utilize the movement policy and resolution as guides for the activities. And this is a tool that can be used to hold accountable the movement components, but also the states to their commitments on MHPSS. And then I will just end there with a big thank you to all the national societies that appointed representatives and has been part of supporting the working group. Particularly a big thank you to the Iraqi Red Crescent, Honduras Red Cross, Colombia Red Cross, Yemen Red Crescent, and Ukraine Red Cross, who all shared their experiences and helped us see what happens in the different contexts over time. It's been a very huge inspiration and a big pleasure hosting the working group too. So from Sarah and myself, a warm and heartfelt thank you to all the national societies who's contributed.
Okay, great, Louisa. Thanks a lot for the presentation. It's really a very important topic, coordination and collaboration, which could be a great opportunity for everyone, and at the same time a big barrier sometimes. And thanks a lot that you capitalize all of this for us and share this checklist, just to remind everyone, especially on some response operations, we need something quick, just to remind ourselves what could be done. And if we will use some joint tool and documents, we will receive the same reminder from all partners. It really strengthening cooperation and coordination. Sarah is already here. Do you know? No? Okay. So now we can pass the floor to our colleagues from the field. What do you think, Louisa?
Yeah, let's continue to see what is actually happening. I think that is much more interesting than me sitting here talking about what we found at a global level with a very small sample. I think let's dive into the context where this has actually taken place.
Yeah, thank you. I'm really excited and looking forward to presentation from the field, just to provide us more understanding how it's really working on practice, this work. And our next presenters are MHPSS focal points from Iraq Red Crescent and Ukrainian Red Cross, who really work hard during the past years on the strengthening, for sure, MHPSS services and activities within their national societies. but as well to improve cooperation and coordination with movement partners and partners outside of the movement. And I would like to first pass the floor to my colleague from Iran, Crescent, Rana, Khalid. She is an MHPSS focal point, as I mentioned already, and she is the National Society, lead of the National Society PSS section. Rana, please turn on your camera to provide opportunity to everyone to see you. Yeah, also I would like to mention that Rana is MHPSS focal point also for Partner National Society in Iraq and directly involved in the planning, implementation of activities and evaluation of the MHPSS interventions in the Iraq Red Crescent Society. So Rana, welcome to our webinar, and thanks a lot that you agreed to share with us some really interesting experience. Please go ahead, the floor is yours.
Thank you so much. I need to present in Arabic, if you agree, because I'm very well in Arabic. I can present in English, but I will present in Arabic. Just I need to add one thing in introduction myself. I encouraged Barcelona واستمد طاقتي الإيجابية من فريق برشلونة.
I will be presenting in Arabic language. Can you hear me?
Yes, we can.
راح أتحدث عن الوضع الإنساني بالعراق.
The situation of humanity in Iraq. Change for her the slide. I think that's what she's saying. I don't know if somebody is going to handle the slide for her.
Okay.
The country. The context of the Iraq, as we have seen it in the screen, it is due to the war which is continue, and because of the presence of the Islamic State in Iraq and Syria, and this has given to the displacement of people inside and outside Iraq, and a lot of refugees in Iraq and Syria, and also from 2014, where we still have a lot of refugees, and we have people in the displacement camps. I want to give you a highlight on Iraq, on the climate changes and its impact, and it has affected the mental health and psychological situation and on the people of Iraq, and they are getting a lot of mental issues, and this it has risen very much, and we have seen this, it has increased to, this mental health has increased, and we have seen how this has increased to affect the various people according to the, and we see 1 in 3 of those receive treatment from mental health services. As you can see on the slide, the mental health of the people in Iraq, it is actually 7. I want to give you a highlight of this, and also the war and the social issues in Iraq. and also the climate change, and all this has given to some in organization which are implementing, and also the government institution do not have the capabilities to implement. And next slide, please. The the Iraqi Red Crescent is working to the advantage of the deprived people, provide social and health service directly. Iraqi Red Crescent will work to give them this work, and also we give them social and healthy support, including mental health, work with the local and international stakeholders, both local and international. Next slide. The strategy which is being used in this MPSS provide psychological support, improve the private care. But there is Yasin has come with a program to help those who have been affected in this program, and also for the MPSS and mental health issues, so that we give them primary health care and MPSS and all other relevant services. And we in this year or next year, we are going to go into mental health programs and get feedback. And we are working to improve this to improve this MPSS work. But now our focus is currently to try and get for the next slide. Methodology which is being used by the Iraqi Red Crescent is the movement MPSS policy resolution and framework, and so interagency standing committee established by the UN. And also we have worked with the Palestinian Red Crescent and Syrian Red Crescent, and we are working together with the Syrian Red Crescent. We are some other external organization to give pamphlets, books, and other relevant information. Next slide. Before that, the methodology which is being used for 2014, we have used it as the Iraqi Red Cross Center. Hello? In the first level and the second level, now we're in the third level and in the next 2 years, we are going to go into the fourth level within the Iraqi Red Crescent. The next slide. Next slide, please. This is Mario. Hello?
تمام. بالنسبة للمستوى الأول إحنا كخدمات نقدمها.
On the first level, we have done the following. As
level 1 أي no before
level 1.
before
Yes.
تمام أوكي. بالمستوى الأول من الهرم التداخلات
If we see the pyramid, some intervention in level 1, this is what we have done with the Iraqi Red Crescent. We have made some visits to the kids, to the youth, and also voluntary services and common on building capacities. We have 20 employees in all the branches of governors in Iraq, and we have 30 people who have been trained who can be able to work all the time that they are needed. And we are also working toward exchange of common experiences with the Syria Red Crescent, and giving out pamphlets and visits and home visits. With the second level at the pyramid, we have some activities where we have to help the various volunteers, and we have other various programs and training, and we support children. So, and also we support the kids, children who have been affected mentally, and also, and we come with other various programs for trainers, and also we work in this in the second level, same of building capacity, we have 20 trainers, and also we have training for them on the social impact, and also for women and the next slide.
Excuse me for interrupting you. Just you have 5 more minutes, Rana. Thank you.
Wow. I speak slowly because I know that the translator suffered from. So okay.
Approximately.
Okay. حبيت أسلط الضوء بالسلايد.
I wanted to say to highlight something on the Iraqi Red Crescent is working on to train or to train people on various issues and in the camps for the displaced within Iraq to do away with the mental issues, and we have worked with the Denmark Red Cross, and also we don't have the details of the statistics of our work with them. Next slide, please.
Next slide, please. Yes.
No, yes. This is some of the key examples that we are working with them. This, I just wanted to give them a highlight of what we are doing, the children, youth, and this. And the next slide. Next slide. This shows the work we're doing with the Iraqi Denmark Red Crescent and also other organizations. these two examples it shows the mental issues and that we're working in. Next slide. The partners who are working with us in the mental health is there, like here, Denmark Red Crescent. They are giving us all the finance funding. We have Royal College, Swedish, British, German, Egypt, Jordan, ICRC, Syria, and Palestinian. The next slide. I will not take a lot of time, but these are the partners involved in our work: Danish Red Cross, DRC, RC. We have been working with them since 2014 with the Danish Red Cross and all these DRC, ICRC, Novo Nordic Foundation in the mental health, supporting physical and psychological well-being. وأيضا next slide, please. Our intervention we want to strengthen the capacity of the health worker to deliver respect high quality material in crisis during a time of crisis in the region and also within the region, and also supporting psychological well-being of pregnant and new mothers. Next. Oh, so we have also some workshop with them, and also to train the team which will work in this. We had a video which I could have showed you, but time does not allow for that. And we have worked with National Red Crescent and the Red Cross. And we have a program for the refugees, and also we have a cooperation, tripartite cooperation agreement in this MHPSS, and next week we shall be having another training where on this mental health. Next slide. We have a collaboration. We are strategic meeting with ICRC strategy with the other actors and improve the mail report and the impact of the MHPSS holistic approach. And also we want to enhance cooperation with the International Red Cross. In Iraq, we have a new program which, God willing, will start within these days. We have and also we work with the various the next slide. Coordination for the key enhancing coordinator. We exchange visits, regular meetings as a key element for enhancing coordination, and also learning experiences from different contexts. And also we are working with the Syrian Red Crescent. They visited various areas in Syria, and also they went to the camps for the displaced, and we shall give you details later. and we want to enhance. We work with the Syrian Red Crescent on a regular basis. And also we have another program for children from within 4 years. Before I conclude, I would like to say the MPSS is a work that needs concentration and the help for the Iraq Red Crescent, and we need which will we cannot say all that we want to say. We have we must have a meeting with employees. I have taken more of your time, but I thank you very much, and I'm ready for any questions that you can ask me on this webinar. Thank you very much.
Thanks a lot, dear Rana. Really, congratulations with their big achievements, and so many efforts and work have been done in the past time, and you really show us how the movements, cooperation and coordination can help the national society to reach more people. I'm really even written for you from your presentation, like you mentioned, collaboration and holistic approach make a big impact to people's life. Thank you for this key message, and it's really shown in your presentation. Thanks a lot, please, colleagues.
Thank you so much. Thank you.
Help me to congratulate Iraqi Red Crescent with a big achievement with your reactions. Thanks a lot. And please do not forget to text your questions in the chat box. Now we will go to the presentation from Ukrainian Red Cross, and then we will have time to answer the questions and discuss the points which been presented for us by our lead speakers. So, and now I would like to pass the floor and introduce my colleague, Anna Didenko from Ukrainian Red Cross Society. Anna now is the head of Rehabilitation and Care Department of Ukrainian Red Cross, and it means that she is in charge of physical and mental rehabilitation, and as well for MHPSS activities within the National Red Cross Society. Also, Anna leads the coordination and cooperation with the partners, as well as movement partners and external partners within Ukrainian Red Cross. So, Anna, the floor is yours, and thanks a lot to agree to sharing with us your great experience and your changing context. Thanks. Go ahead.
Thank you very much, Olga, for this presenting of myself, and I hope you can see my screen. Yes.
Yes, it's okay.
Great. So I will try to use 15 minutes that we have. Starting first of all, so speaking about context of Ukraine and what we have now, and I think the situation is changing in terms of the needs. Average, we can say that according to the latest different research, more than 4.5 million of people will need mental health and psychosocial support, and also that 9%, but maybe after a lot of people will be demobilized, we will have bigger percentage. Also, people will experience moderate and severe mental disorders. We also see that there is like a lot of cases of depression, alcohol use disorders, suicide, and also mental health is like one of the second leading case of disability in the country, and we still have barriers to mental health support in terms of the trust to the people, to the specialist, and also stigma around mental health. I think that regarding psychosocial support and maybe even psychological support, it's not, it's getting like better, But in terms of going and seeing psychiatric, for example, and receive psychiatric care, still it's a biggest stigma around this, and also a lack of specialists who can provide this kind of support. Also, we see that a lot of people have the coping mechanism, and they worked good before and maybe last year, but this year we are facing a lot of challenges with that things that was working before is not working anymore. And people, even who didn't need support before, now they need more support. Also, our government, and what we also see and hear from different organizations, that one of the biggest challenge, and it will be more seen in the nearest future, it's social adaptation of the veterans and their family members. Because according to our Ministry of Veterans, we will have more than 2 million veterans and 2.5 million of family members. So it's near 5 million people who will need this kind of support. And also there is lack of human financial resource to address all of the needs, which is huge. And also our government is in the process of, we have running of the initiatives, the First Lady, which is Mental Health and Psychosocial Support Initiative. And basically, mental health and psychosocial support now should be integrated into work of all ministries. And this topic is really pushed by the government. And I think also it's pushing a lot of NGOs to provide more support, and as well as there is different additional challenges in cooperation regarding this. So I will speak about it later, but mental health and psychosocial support is one of the highlighted topics in all governmental programs, and we have more and more requests regarding this. And also the other problem is that people who provide support is influenced by the war themselves, and they also need more support. So very quickly, we have a development of mental health in Ukrainian Red Cross since 2014, and this capacity building also give us opportunity to be able to respond to the needs in 2022-2023 faster. So basically, we started from the project approach when we was implementing projects, and with different outcomes, different objectives, different target groups, different approaches. And in 2018, we established MHPSS unit, PSS unit. And after that, PSS was recognized by also management of the Ukrainian Red Cross as one of the priority areas. And since then, we was working on regulation, SOPs, training, service specifications, which help us, and still we are working on it, on building the standardized approach to MHPSS in all over the country. And before the war, in the full-scale war in 2021, we was providing activities in 6 regions, and also train psychological first aid of staff and volunteers. This year, our unit was renamed to Mental Health and Psychosocial Support Unit. One of the reasons was also because we see more needs in, I would say, psychological support and referrals to more specialized services, which we are now developing together with basic psychosocial support. And since 24th of February 2022, we provide both direct psychosocial support activities and also integration of MHPSS into other sectors. And speaking about direct activities, we have recreational activities, we have psychoeducation sessions, we have activities for adults, elderly. This year, we 2 months ago start to pilot non-specialized counseling, and also working on more, I would say, more specialized. It's more third layer of the pyramid in terms of interventions that ICRC is using, like Book About Me. And also our aim is to develop more focused psychosocial support activities further. And we also provide outreach PSS during distribution. We worked in the railway stations or during the evacuation. We had establishment of the child-friendly spaces. More than 70 child-friendly spaces was established. We also created 7 PSS centers in the different regions of Ukraine, which also aim to provide a wide range of services to the affected population. Also, we have psychologists in mobile health unit who is providing basic counseling, who's providing also psychoeducation. Also, our aim is to train all staff on mobile health units and also social workers in PFA, so they are able to deliver basic support while they are providing other kind of services. We also have a hotline, and we have psychologists working in a hotline and providing counseling. We also offer PFA online and offline trainings for the population. Also, we try to adapt this training according to the different target audience, and in some cases, it's like mixture of basic PSS and PFA according to the needs of the people we provide this training for. And also, like training staff and volunteers, caring for staff and volunteers. We are also working on this development of this system. And speaking about target population, I would say it's like all population of Ukraine, but if we speak about categories, it's IDPs, it's people living in affected areas, and we have a lot of like big percentage of population living in these areas very close to the conflict line. We have also vulnerable local communities, family of killed, of missing, veterans, family members of veterans, staff, volunteers, and first-line responders. And as I was mentioning about this initiative with the First Lady of Ukraine, we receive more and more requests about trainings, starting from trainings and also PSS support for teachers, doctors, social workers to also receive a lot of requests from other NGOs to train their volunteers, their staff on PFA, like provide them training of trainers and so on. And if speaking about few numbers, this is for 2023, we have more than 200,000 people receive mental health psychosocial support services. Out of them is 179,000 children. Also, we have more than 20,000 people who receive support during evacuation, delivery of humanitarian aid in the place of transit, during social activities. We have also staff, volunteers, medical workers, social workers who was trained in PFA and basic PSS. And if calculate in total, it will be 1,500 probably people. And also we have psychosocial and psychological services provided for staff and volunteers. We have a company who is contracted to deliver free psychological sessions, and also we have peer-to-peer informal, formal meeting for staff and volunteers. So during this year, it's more than 1,600 psychosocial support services for staff and volunteers was provided. And only in 2023, we have almost 23,000 activities that was held in all over Ukraine for both beneficiaries and also for staff and volunteers. And also speaking about programs, as I was mentioned, we are running from a project approach to program approach, and also we try to standardize our activities. Well, how does it look in reality? In Ukrainian Red Cross, last year we developed one plan. Now it's called One Plan for 2020 to 2025. And each direction, each area of the Ukrainian Red Cross define main objectives. All activities, not matter what is the donor, should be target one or a few objectives. So first objective is about support to the beneficiaries. It's about populations that was affected by the conflict. They receive support. Other outcome is about supporting and caring working environment for staff and volunteers. And the third one is that we need to have enough staff and volunteers, and they should be trained to be able to deliver services which is needed for the beneficiaries. So now we use the same indicators, the same objectives to all programs that we are preparing, or projects that we are preparing. So we still have projects, but we try to implement program approach and work with other regional organizations in the same way. So basically saying them that they have mental health psychosocial support activities, but it's not like separate project. It's that those supports that they have to provide to the beneficiaries, no matter what is the donor or no matter what is the project naming. And we have a lot of partners involved with the mental health psychosocial support. So we have Danish Red Cross, German Red Cross, ICRC, Swiss Red Cross, Norwegian Red Cross. Also PS Center support us with technical things, and also ECHO project, but it's also implemented through two donors mentioned before. It's Danish and German Red Cross. And this is a Ukraine map. Now we are working in 22 regions and in the city of Kiev, 22 regions out of 24. In one region, we will, in Zhytomyr, we will scaling up till end of this year. In Luhansk region, we cannot work like right now because it's area of almost all of the area is occupied. So it's one of the region we cannot physically have access there, and to the Crimea Republic as well. In all other regions, we already having activities, or we will start activities like in the nearest future, is, as I mentioned, in Zhytomyr. So basically, I think you will have presentation, so you can also receive more detailed information here. And
sorry for interrupting, 5 minutes.
Thank you. So I will move on first. We have developed materials, and what those materials that we used is not all of the materials. It's like an example. We have a lot of peer center materials translated into Ukrainian, also adapted. Some materials we developed also by our technical team who is working in headquarters. And as I mentioned, we have very good I would say resources to provide and conduct activities in a basic support and focused psychosocial support, but still we need more, and we will focus in more on developing more psychological counseling, and also more training in focused psychosocial support, which we see now is more needed. And speaking about collaboration, we have a biggest MHPSS working group in Ukraine, which contain more than 250 organizations. And ICRC has taken part in this working group. I think since the creation of this working group, it was in 2015 or 16. Also Ukrainian Red Cross, we attend health and protection clusters. We also have MHPSS Coordination Center under the Cabinet of Ministers of Ukraine, which was created this year. We also coordinating our work with them. Their approach is to basically make this coordination between NGOs and government more clear and also more structured, I would say, especially in regions. So we are working very closely with them. Then also we have partnership with national societies, ICRC PS Center under the EU for Health program. And as I was mentioning, we have this initiative, the First Lady of Ukraine, and last week, we took part into the updating of the operational roadmap for Ukraine. for mental health and psychosocial support. And what events we initiated in Ukraine. So we have a regular basis mental health psychosocial support technical working group for all of the partners who is supporting us in a country. Then last year we have MHPSS workshop for sharing of methodology. It was between Ukrainian Red Cross and ICRC. Then we have also, there was needs assessment conducted at PS Center last year. Now we are in process of needs assessment supported by Danish Red Cross. Then we also had a workshop for our staff and volunteers about caring for staff and volunteers in February. And we developed framework of the integration of mental health into health programs. And then we had in April International Rehabilitation Forum. One of the topics was also about mental health and psychosocial support and how it can be integrated. In May, we had health strategic workshop. In the Ukrainian Red Cross, MHPSS is not part of the health department. So it was also a good way of the coordination of MHPSS with health and with other sectors. And recently we had MHPSS integration workshop, and aim of the workshop was creation of the framework about how we will work with integration of the MHPSS into all other programs, all other departments, because as I was mentioning, we receive more and more requests about this kind of support, and it should be integrated even more into all work of all other departments. And I would also like to strengthen what is the strengthening of the coordination and challenges. So first of all, it's we see that MHPSS delegates that we have during the long period of time was supporting us very good with coordination. And last year, when the full-scale war was starting, it was like lots of partners coming and asking for what we can do, how we can support. So it was very good that we have the lead of the Danish Red Cross and MHPSS delegate who supports this process. Also, what we see now that we still need a lot of technical support, but also when national society has enough capacity and knowledge, like we should define and coordinate and lead this coordination in the areas that we see as a priority. And also it's good to be able to share information, knowledge, training. Also we can support more people if we have good coordination, and if this coordination is established and working, we can like spend less efforts for this system to work. But also we see there's some challenges in working with different partners, and I think it's also related to what Louise was mentioning today. It's about not always delegates are properly prepared, and there is a need for a lot of additional time to be able to understand what is going on in the country. Also, the main goal in supporting people and national society of I would say about Ukraine should be a priority, and it's not a competition or like influence of different partners in Ukraine. Also, there is not always possible to receive all information that is needed. So some partners is more closed than other, and not always it's possible to receive all like trainings or other things that may be useful. And also we spend more time to explain to the partners about our strategy, about one plan, and trying them to work in this area together with us. And sometimes there is working with the local branches without involvement of the headquarter, who is responsible for coordinating all of the work in Ukraine in terms of the mental health and psychosocial support, which also cause additional challenges and additional meetings. And we have this splitting of MHPSS and health department, and also in terms of coordination, it's not always clear to the partners. They use the approach that is working in their national societies when health and MHPSS is linked together, and it causes additional challenges. All of these challenges that I was mentioning, like ending in too many additional meetings. Basically, sometimes we have like meetings, like 5-6 meetings per day, and most of them it's about working with different partners on how we should work together and trying to fix what was not working good. I think that's all. Yes. Thank you. If you have any questions, or maybe I need to speak about something more, please ask.
Thanks a lot, Diana, and also congratulations for big job, and thank you that you really show us how much efforts have been done by the Ukrainian Red Cross, as well with support with partner national society, and how you really improve your work through collaboration and cooperation. And for me, it was quite interesting also how the collaboration and coordination could be improved if it's supported from the state, I mean initiatives of the First Lady. That, yeah, it's really could improve and help us a lot, but also provide to us a lot of job and new tasks. Thanks a lot, and congratulations. I hope I will ask also Rana to join this session to turn on your camera. And now we have 2 questions in the chat. One of them to Rana. Sani asked to explain briefly about the mainstreaming of MHPSS activities in cash. And also just for Rana, can you make it in short, because we have only like 6 minutes till the end of our webinar. Rana, you're muted.
بس ممكن إعادة السؤال. Can you repeat the question? يعني in Arabic, I didn't understand the question.
Okay, it's you're kindly asked to explain briefly about the mainstreaming of MHPSS in cash in Iraqi Red Crescent.
لا, can you ask again in English?
Briefly explain about mainstreaming of MHPSS in cash.
In cash. Okay. يعني احنا
For us,
كهلال أحمر عراقي
as the Red Cross in Iraq,
نعمل على دمج الصحة
our role is actually to support psychological and how people live in Iraq, and how we transfer these funds to affected family members, because this team has experience in dealing with people who have a psychological problem. So these activities that helps the community how to survive, how to live in a difficult condition. And also these efforts help the youth to take you to the training centers so that they're empowered and they're able to live in them. Our team actually has several trips to villages, and so they know what's going in the field. They know what's going in the villages, especially displaced people. So they know how to deal with them, and they know how to support them. So there's a team that in Iraq that follows these activities, especially people who have a mental problem. They know how to deal with them, and they know how to support them.
Thanks a lot. Great. Also, like you show us internal cooperation in the national society with different sectors, and that could help people Thanks a lot, Rana. Also, one more question from the chat, because it's for all experts who are now in the room. It's a question about evidence on PFA and PFA impact. May someone know if there have been recent research in the field that can inform on benefits of PFA for crisis-affected people? Anna, perhaps you have done some kind of evaluation or assessment and about PFA impact.
Yes, we had, like, I would not say it's like a research, but as I was mentioning, we done trainings on psychological first aid for social helpers and for the mobile health unit. It's not like the research, but we make a questionnaire and more than 500 people respond to it. Questionnaire was about if our training was useful and how often they use PFA skills. So more than 90% of responders say that they use PFA skills all the time in their work. And more than 70 or 75% mentioned that training in psychological first aid was very useful for them and helped them to deliver better support to the as well for themselves and for the beneficiaries. As I mentioned, it's not like, it's more this like questionnaire, but it was done like maybe a few weeks ago.
Not so much about benefits for people affected by crisis, but also we can like just thinking that if people who provide other services and use PFA, so it could be useful for population as well. Louise, perhaps you have the reply to this question or not?
I think it's a super relevant question, and it's a much bigger question that or a much bigger topic that anyone can actually answer and discuss in a minute. There are different groups looking into PFA. For example, working group 1 is one, and then there's also a group that's a pledge group on PFA where they're diving into varieties also around PFA and the evidence. Yeah, I think the whole debate is still there. Is it an activity? Is it a skill set? What is it? For me, on a very personal note, and what I can say is that I do see a difference in whatever we do if people have been trained and are able to listen in a supportive manner. Whether they're doing that as part of a basic service provision or you are a more specialized service provider, it doesn't matter. But that's also just anecdotal, and I'm aware about the same type of research. I think the PS Center has also published some papers around this on their website. So different resources out there available.
Yeah, thanks a lot, Louise. Perhaps we have, no more minutes, but I kindly ask you to say as last, like just in one sentence, is key message for the participants of this webinar. What does it mean, collaboration and coordination, and for your advice how to strengthen in MHPSS interventions, collaboration and coordination? And I don't know who wants to start. Okay, Anna.
Thank you. So I think coordination is a big challenge and gap for all national societies and movement, and not only movement. But my advice as for the partners will be listen to the national society and see what is the real needs, and do not think that what was working in other contexts will work here. Sometimes it's relevant, but it's also good to understand that every context is different. We speak about it all the time during the trainings, but I think in reality, like, we need more practical steps, how it's look like. So basically like checklist, what does it mean, follow the context of the country.
Great, thank you, Anna. Rana, perhaps you have some advice for participants?
يعني شركائنا في الحركة
Our
الدولية
partners, international partners,
جدا
they need to
متعاونين
understand us
في تنظيم المشاريع وإعداد الخطط.
especially in organizing these activities.
حقيقة نواجه صعوبة في البداية.
There's a lot of challenges and some difficulties in this field actually.
يعني
So
بالمستويات يعني الشرق الأوسط
in different levels, especially in the Middle East, Arab countries, there's a lot of challenges, difficulties.
لكن في النهاية تتوحد الأفكار
But
ونعمل
at the end of the day, we need to have
على يعني
ideas
السياق
that we can
الخاص.
agree, we can discuss, so that we implement our work or activities.
وعادة يعني إحنا في الحياة الطبيعية لما نتعرف على شخص جديد تكون صعوبة أن يعني
especially in what we in our current world, when you see a new person, sometimes it's difficult to work with him, but we are human beings, we need to work.
الشركاء هم مو غريبين علينا، هم أعضاء بالحركة الدولية، لكن بحكم الاختلاف السياق المجتمعي.
Most of their partners are actually international partners, but we need to work together as one family to ensure that whatever we do is being implemented.
Thanks.
وشكرا جزيلا يعني لكل الشركاء العاملين معنا.
And thank you very much for all partners that are working with us.
أتمنى أنه تتوسع الآفاق أكثر، لا تكون محدودة في مناطق
معينة. And I do
معينة.
pray that we'll expand this network and work across thousands of most of the countries across the world.
لأنه أغلب المانحين يعني يستهدف المناطق اللي بيها فقط نزاعات.
Because most of the sponsors or partners, they only target where there is crisis only. But these activities, these challenges are across the world, not only places where we have crisis, but even in places we don't have crisis, we have these problems.
Yes. Thanks a lot, Rana, that you also raised this. Yes, we're really one family and we will have to work together. Thanks a lot for this. And Louise, your last short message, please.
Yeah, also from a more global international perspective and as being one of the partners in these contexts, listen to the national society. Let the national society be in the driving seat. They are there. They're there all the time. We come in and out. The national society is coordinating a lot already, both with internal partners, external partners. So another key message for me would be, don't create unnecessary coordination mechanisms. Utilize existing mechanisms, utilize existing services, and see how to strengthen the referral scheme and structure with the services. Make sure you know what is a quality service in this context, and see how to support a national society in better utilizing what is there instead of creating parallel systems and structures. How can we do this work more efficiently? If we are able to do so, I think we will reduce costs that can then be used to spread more widely and we reach more people. So yeah, and then be mindful. The context differs, people differ, preferred ways of working, it differs. So really pay attention and use these skills that around active listening and more of the PFA maybe.
Great. Thank you, Louise. Yeah, really, thanks a lot for all our speakers today and for all participants who are joining. And also what I'm just, thank you for your heart on as well. And also what I would like to say that we will never forget that we work for people and we work with people and we are able to agree to everything and be better anytime and any day. So dear colleagues, take care and have a nice week. And I would like to say goodbye for all of you. Bye.
Bye.
Bye. Thank you, everyone.
Bye. Thank you so much.